This is a Bibliomotion audiobook, produced and distributed by Gildan Media in partnership with Bibliomotion. Self-Hypnosis, the complete manual for health and self-change. Second edition, by Brian M. Alman, Ph.D., and Peter T. Lambro, Ph.D. Narrated by Sean Pratt. We hope you enjoy this program. Forward to the second edition. Most people have their first, maybe only, exposure to hypnosis through stage show hypnotists and Hollywood productions. From this, they form the impression that hypnosis is something mystical and dangerous. Hypnosis is portrayed as a scary form of mind control, where the helpless victim gives up control of himself or herself. If this were an accurate portrayal of hypnosis, then hypnosis wouldn't interest me so much. As a clinical psychologist who treats people with a wide variety of problems, I've never had anyone ask me to help him lose control of himself. On the contrary, people come in wanting to establish more control over their lives. Hypnosis is the most powerful means for doing so that I am aware of. What Brian Alman and Peter Lambro have done admirably in this book is to provide you a means for having more control over your experience. They, too, are clinicians, and their many years of helping people discover skills and resources within themselves for improving the quality of their lives are evident throughout this volume. Alman and Lambro have done a wonderful job of taking the hocus-pocus mystery out of hypnosis, thereby helping the reader and listener discover that quality of life is a frame of mind. They have done a good job of acquainting the reader and listener with innovations in the field that usually only other clinicians have access to learning. Furthermore, they integrate abstract and professional literature with common sense applications. And it's the applications that are the strength of this book. Alman and Lambro have made it possible for anyone interested in taking care of him or herself to learn simple and effective ways of doing so. They repeatedly emphasize that the uniqueness of each person is an ally when we learn how to recognize and make positive use of that uniqueness. They teach us that our views of ourselves and our individual worlds are changeable, not set in concrete. Best of all, they teach us that we can change our views when we change our ways of talking to ourselves. In their gentle, permissive way, the authors give us lots of guidance while simultaneously encouraging us to explore and discover what works best for us as individuals. The authors address so many dimensions of life and provide so many ideas for ways to enhance your experience of life that it would be to your advantage to use this book as both a guidebook and reference manual, listening and listening again to sections of greatest personal interest. The practical nature of the material easily lends itself to continuous adjustments and refinements in your self-hypnosis skills as your abilities evolve. For the clinician and layperson alike, the many case examples and sample procedures will undoubtedly stimulate greater mystery on a variety of levels. Most of all, I think the message in this book that I find the most encouraging and respectful is one of personal empowerment. The authors exude confidence that the listener can learn and benefit from the methods described here. Learning from your own experience that you can gain control over symptoms or experiences that used to seem uncontrollable can provide you with a wonderful sense of pride and accomplishment. I expect you'll discover that in your own way with the skilled help of Alman and Lambro. Michael D. Yapko, Ph.D., Director, Milton H. Erickson Institute of San Diego, California. Forward to the first edition. Once in a while, progress in the sciences is made through a unique combination of principles which previously were considered to be incompatible. Dr. Alman has succeeded in making such a leap with this brilliant book on self-hypnosis. Most books on this and related subjects require the listeners to follow a rigid program of self-development. Due to their standardized format, they allow for little or no variety in individual responses. This book is different. It offers a very well-written, step-by-step program for self-hypnosis, which may be applied to a wide variety of goals. At the same time, It describes an individualized approach. Dr. Alman shows his readers and listeners, time and again, how they can fit this excellent program to their individual needs, interests, resources, and specific life situations. No one else had done this before. Moreover, the listener's success with self-hypnosis is not dependent upon a single intervention only. Instead, Dr. Alman suggests many different pathways to achieve results. While this book is primarily intended for the lay listener, doctors, psychologists, and other qualified professionals wishing to use hypnosis in their work will benefit from this thorough and pragmatic explanation of clinical hypnosis. Indeed, there is no other book where they can find basic hypnotic procedures written in the language in which their procedures ought to be applied, in an imaginative and permissive kind of language, which helps people to realize their own inner resources in their own unique ways. I suspect that this book will create an uproar among some of Dr. Alman's professional colleagues. They will think that he has given away the very best of their professional work to the general public, that he has made potential clients more self-supporting. Nevertheless, he realizes that hypnosis belongs to the individuals experiencing it, and he teaches them to utilize their focused state of consciousness in a very safe and rewarding manner. Dr. Alman is a very experienced psychologist and hypnotherapist who has had two of the best teachers. The first was the late Dr. Milton H. Erickson, the man who revolutionized both hypnosis and psychotherapy. The second was Dr. Alman's own extremely painful physical condition for which self-hypnosis proved to be the only remedy available. There should be no doubt that Dr. Alman's program in self-hypnosis is rooted in both the best clinical approaches to hypnosis and his own personal experiences, as well as in his therapeutic work with hundreds of clients. Moreover, his teaching abilities are internationally recognized. Dutch colleagues, for instance, of which I am one, who have been trained by many internationally well-known hypnotherapists, rate Dr. Alman at the top. Onno van der Hart, Ph.D., Dutch Society of Clinical Hypnosis, Professor, University of Leiden, the Netherlands, Clinical Instructor, Dirksen Center, Amsterdam, and author of Rituals in Psychotherapy. Preface. The pain was horrible. It disturbed my work, my home, my whole experience within me for many months. I was told by the doctors that I would need a body cast for 6 months, surgery, then a body cast for another 6 months. That possibility would get rid of some of the pain in my lower back. Still, no guarantees that I wouldn't be worse off than before the lengthy and costly procedures. A friend suggested that I try hypnosis for the pain. After waiting, hurting, and remaining undecided about the surgery, I went for help to a psychologist trained in hypnosis. I had no noticeable success the first couple of visits, but I was learning to understand more about my pain. In a few more weeks, I began to get some relief. After about 3 months, nearly half the pain in my back was gone. I thought it was a miracle. I went back to the orthopedic surgeons who had recommended surgery. They thought hypnosis was ridiculous and that very quickly the pain would come back, that I would be on the operating table soon. This only fueled me to work and learn more about what was happening to me. These surgeons had my respect in the beginning, but I was disappointed by their closed-minded attitude about my success in controlling the crippling pain I had been suffering. I began to read everything that was available in hypnosis at the time. The journey that began with solving my own chronic pain condition developed into a career choice to better understand hypnosis. In the mid-1970s, I studied with Milton H. Erickson, M.D., a well-known physician and innovator in hypnotherapy, at his home in Arizona. His tutelage and his sensitivity with his patients and students were an inspiration for that group of us who studied and even brought our own patients to work together with him at his office. Nearly 20 years now, since my first back pain, I am running and am free of 99% of my discomfort and pain and have been for most of those years. Still, I practice self-hypnosis every day. I have been traveling to medical schools and other learning institutions in this country and abroad, teaching clinicians and the public how to include the natural abilities of self-hypnosis in their practices and their lives. I had been working on this book for many years, and at each seminar and class I was asked when it would be completed. Finally, with the help of my co-author, I described the most complete methods for learning and using self-hypnosis that are available. And now, the second edition of this book incorporates the further experience and learning I have accumulated since the first edition appeared almost 10 years ago. In writing this book, I hope I can share the benefits and personal enrichment of self-hypnosis with many more individuals than I ever could in several lifetimes of classroom teaching. This book is not intended to replace conventional therapies or medical treatments, and you are advised to seek professional help should you have concerns. The methods and techniques in this book represent the most recent developments and applications in the use of hypnosis for a variety of problems, as well as for understanding and enhancement. Often, these methods are a departure from old-line hypnotic practices that were limited in their scope and effectiveness. Most recent studies, in my own experiences in my private practice, show that the combination of techniques that we have assembled here can be used by virtually anyone. This includes people who have been found to be unhypnotizable by rigid and specific testing. Arranged in a convenient self-teaching fashion, this book can be used by both individuals and therapists to learn self-hypnosis on their own or as part of an overall therapy program. It's written in plain language, with full explanations and many examples. Modern self-hypnosis operates under a variety of labels: visualization, guided imagery, goal-directed relaxation, autogenics, self-suggestion, and others. Call it what you will, the principles and the goals are the same. All of us look for ways to be more effective in our lives. The intention of this book is to open some new doors, perhaps reopen some old ones, and to keep all present doors open for positive changes. The techniques described here are not static or unchangeable. You are encouraged to put yourself into the techniques and adapt them for your own adventure into understanding and changing yourself. Listen to this book and enjoy your new skills for self-change and good health. Brian M. Alman, Ph.D. Section 1. Learning Self-Hypnosis. Welcome to Self-Hypnosis, a tool for making changes in your life. Everyone knows that problems are a part of living that we all face. However, perhaps not everyone realizes that all of us carry around within ourselves the resources for survival, personal evolution, and success. This section of the book is devoted to helping you develop your ability to enter self-hypnosis and provide yourself with meaningful and effective suggestions for self-change. Listen to this part of the book through completely, and then proceed to the chapters that interest you in Section 2. Chapter 1. What you can expect from this book. Dr. Albert Schweitzer once said, "Patients carry their own doctor inside. They come to us not knowing that truth. We are at our best when we give the physician who resides within each patient a chance to go to work." Are you investigating self-hypnosis for the first time? You may be interested to know that nearly everyone can learn how to use self-hypnosis to make specific changes in him or herself, to stop unwanted habits, to prevent headaches, to reduce stress, to control pain. Perhaps you want to enhance your decision-making and to increase your concentration, to improve your athletic ability, to cultivate better communication in personal relationships, to be more effective in your own personal goals, or even to improve your business achievements. This book will help you achieve or enhance success in all these areas and more. It will provide you with detailed explanations of how to develop your capacity for self-hypnosis to reach your goals. Who can use self-hypnosis? Clinical use of hypnosis has been linked with susceptibility test scores for a long time. Doctors who used hypnosis in their practice might first have given patients one of several tests to determine the likelihood of success. In the last several years, studies have shown that even people who score low on these tests are hypnotizable. There are innumerable variations of hypnotic techniques. A poor score on a particular test shows only that a person is not responsive to the specific method used in that test. Self-hypnosis that takes into account people's perceptions of their own experiences has been found to be successful with nearly everyone. The idea of using the personal experiences and perceptions of the individual was pioneered by Dr. Milton H. Erickson, a noted physician, teacher, and author. Erickson's view was that hypnosis was most likely to be successful if the suggestions were meshed with words, symbols, and images to which the individual could best relate. He was adept at picking up these impressions from a patient in just a few moments. Often, patients who had been given up as hopeless after all other treatments had been exhausted were referred to Erickson. These were frequently people who had tested as unsusceptible to hypnosis. His method not only blended the patient's own experiences into the suggestions, but also used a more indirect, permissive, and flexible language. Most people think hypnosis uses commanding language, such as, "You will feel," or "Now you are going to." But Erickson's suggestions would contain many phrases such as, "You may feel," or "Perhaps you will notice that." These suggestions don't command or direct the person. They imply and leave open the possibility of some different experience. And many people who have difficulty accepting commands find it much easier to respond to the more flexible suggestions. Many others have now come to believe, as Erickson did, that with the right approach, practically everyone is able to enjoy the benefits of the hypnotic phenomenon. It is only a matter of finding the right technique for the individual. Erickson, as a therapist and a teacher, pioneered the use of individualized techniques and variations to accommodate the unique experiences and needs of each person. We also follow that approach. You will find many places in this book where you are asked to look for something in your own life experiences with which to blend the suggestions. If you take the few moments necessary to personalize the techniques for yourself, you will reach your goals more quickly. We describe many methods for developing a self-hypnosis trance and for accomplishing goals. You can find the method or methods that you are most comfortable with and that work best for you. We will show you how to modify and adapt them to the uniqueness of your own personality, situations, and experiences. Many listeners will be successful using several or all of the methods described. However, if one or another does not seem right or comfortable to you, encourage yourself to be patient and try one of the other methods for developing your trance. How you can get the most out of this book. There's an old story about a young man rushing down the street with a violin case under his arm. He frantically stops an old gentleman and asks, "How do I get to Carnegie Hall?" The old man looks at the impatient young man and somberly replies, "Practice, practice, practice." Self-hypnosis is a skill. Like throwing a ball, it's a skill that nearly all of us can do naturally. With practice and instruction, you can not merely pitch the ball aimlessly, you can pitch to the target. You may have one or more goals in mind to work on with self-hypnosis. First, become experienced with the techniques for entering trance. It's while in a self-hypnotic trance that the drawbridge is down for suggestions to your unconscious mind. Some people learn self-hypnosis quickly, and others take more time. How quickly or slowly you learn has little to do with how effective it will be for you once you have mastered it. If you are in pain or have some other immediate use for self-hypnosis, you will be tempted to jump right into work on that goal. However, wait until you understand the techniques of self-hypnosis Then feel free to start blending suggestions for the specific change you seek into your practice. Self-hypnosis to remove limitations. The hypnotic phenomenon is not magic, not occult. It is a natural, normal state of mind that you can use to instruct and direct your unconscious mind and body. We all carry around the abilities to reduce stress, control pain, conquer fears, overcome allergies, and alter unwanted habits. George, a 48-year-old salesman and client, suffered from lower back pain for over 7 years. He had disc surgery and had been on various pain medications for most of those years. The pain had interfered with practically every aspect of George's life: sleep, sex, exercise, social functions, dancing, and even his job enthusiasm. He sought help through hypnosis after he developed an allergic response to the most recent pain medication. Within 8 weeks, he learned self-hypnosis well enough to get as much pain relief as the medication gave him. After 6 months, he had more comfort and a greater freedom from pain than any time since his injury. After 1 year, he reported a definite improvement in all those areas of his life that had suffered as a result of his pain, and he was taking practically no medication. Julie, a 35-year-old waitress, had been struggling with her weight problem for nearly a decade, ever since her first pregnancy. She seemed to have been on a continual diet. She didn't like the way she looked. Her physician had urged her to lose weight for the sake of her health. The final straw came when she overheard 2 customers in the restaurant where she worked commenting about her size. She began instruction in self-hypnosis with the motivation to change her eating and exercising habits, specifically to decrease the former and increase the latter. She altered her perception and desire for food. She used post-hypnotic suggestions to resist excessive eating and encourage herself to exercise. Julie lost 65 pounds in 9 months. More important, 2 years later, the excess weight was still off. She was still exercising regularly and loved the way she looked and felt. What you will learn from this book is a way to redirect your internal resources to achieve your goals. You can make yourself more capable with self-hypnosis. Most of us only use a thimbleful of our potential. Even the brightest people may only use 1/10 of their natural capacity. The natural mental potential you were born with is waiting to be tapped. Chapter 2. What are hypnosis and self-hypnosis? Nearly everyone has experienced a trance-like state many times, though they might not have called it hypnosis. Have you ever caught yourself daydreaming and not noticed routine things happening around you? Have you ever been absorbed reading a book or engrossed in an intricate project and not heard someone speak to you or not noticed how much time passed? Perhaps you have had the experience of being so engrossed in a movie that you realized that it was almost over, and yet it did not seem like over an hour and a half had passed. Or you may have been driving on the freeway, absorbed in your thoughts, and then noticed that you had missed your exit. These are hypnotic-like trances. The main difference between these sorts of trance and self-hypnosis are specific motivation and suggestions toward a goal. Hypnosis channels the trance to achieve some desired result, like relaxation or relief of pain. It is common for people to disbelieve that they have been hypnotized the first time or two it occurs. The reason is that the hypnotic trance is not a completely unique feeling. The absorption you may feel is familiar. Hypnosis is not a form of sleep, though a person in a trance often appears to be asleep. Actually, the opposite is true. The brainwave patterns of people in hypnosis show alert wakefulness. Hypnosis has been given various definitions. Since no one has discovered exactly how it works, we can only describe its effects. And like the 7 blind men describing the elephant, our descriptions differ depending on our unique perspectives and perceptions. Each person experiences the hypnotic phenomenon in his or her own way. Here's a definition that seems to explain the effects of the phenomenon. Hypnosis is a state of mind in which suggestions are acted upon much more powerfully than is possible under normal conditions. While in hypnosis, one suppresses the power of conscious criticism. One's focus of attention is narrower, and one's level of awareness on a focal point is much higher than if one were awake. During this heightened focus and awareness, suggestions appear to go directly into the unconscious mind. Nearly all scientists and researchers in this topic recognize that the trance state we call hypnosis has special qualities. In it, you can control areas of yourself that are normally out of reach of your conscious mind. If you doubt this, sit down and passively but consciously try to slow your heart rate by 10%, or try to raise the temperature of your hand a degree or two. Those are examples of internal changes that are normally out of your conscious control. Yet, in hypnosis, you can make changes in chemical, physical, psychological, and emotional parts of yourself. All hypnosis is really self-hypnosis. Many people think there is a difference between hypnosis guided by someone else and self-hypnosis. Many experts agree, however, that all hypnosis is really self-hypnosis. A hypnotherapist may help you guide or develop the trance, but you are always in control. It is your hypnosis. That may seem contrary to what you've heard or read. Novels, movies, and stage shows are poor teachers of what hypnosis is really about. They've given hypnosis a mysterious aura that is not deserved. This mystique has clouded the true value of hypnosis as a tool for making important positive changes in ourselves. Stage hypnotism versus clinical hypnosis. There is a big difference between clinical hypnosis and the stage hypnotism many people are familiar with. The stage variety is a performance, a show purely for entertainment. When you examine the process of the stage hypnotists, you recognize some of the techniques they utilize. First, the performer asks for volunteers from the audience. These are people who might have had a drink or three, and their inhibitions are reduced. Many subjects are repeat visitors who are easily hypnotized and are nearly always selected when recognized by the hypnotist. Clearly, those who venture on stage have self-selected themselves to be part of the show. On stage, the performer will try to select those volunteers he or she feels will most readily comply with commands. Those who are judged to be fighting or resisting will be dismissed. The showman is often very adept at reading body language and other subtle signs that indicate that the subjects want to do as they are told and put on a good show. After the performer has carefully culled the group to a handful of willing participants, the show begins. Whether the entire group is really hypnotized or not doesn't matter. The participants may be in a trance, they may believe they are, or they may simply act as if they are hypnotized. Once they are on stage, there is a powerful pressure to go along and not spoil the show. By this time, all participants have been given tacit permission to let their inhibitions remain off stage. They have the perfect excuse for whatever they do. They were hypnotized. Let the show begin. It's not necessary to hypnotize people to get them to quack like a duck, croon like Frank Sinatra, or laugh uncontrollably. People will do both foolish and fantastic things without being hypnotized. A visit to a singles bar on a Friday night can attest to that fact. The Svengali effect? A question often asked in regard to hypnosis is whether someone can be made to do something against his or her will. This has been called the Svengali effect. Many people who have seen stage hypnotism, read novels, or seen movies that include hypnosis ask this question. In the old John Barrymore film, titled Svengali, a bearded madman hypnotized women to do his bidding and commit crimes for him. Even very recent films and television shows inaccurately depict hypnosis. Because of these, many people balk at the notion of being hypnotized in fear of allowing someone to make them act foolishly or do something they would regret. We recommend that you Never allow an unqualified person to use hypnosis.
Sample complete. Ready to continue?